My name is Larry Ahn. I'm a general internist here at the University of Michigan. I'm also the director for the Center for Health Communications Research. I had a pretty awkward childhood. My parents were from China, so we spoke Chinese at home. I had a good friend from Puerto Rico, so we spoke Spanish. And I had a good friend from Korea, so I spoke some Korean. But when I hit the public school system, I didn't speak any English. My early years in school were pretty lonely, and I was not doing all that well, and actually spent many years in sort of the remedial education programs because of sort of the language issues. I realized that I was not maybe going to be smarter than all the people out there in the world, but I was going to maybe work harder than a lot of people out in the world. So it's a combination of whatever smarts you have plus your willingness to work that really makes a difference. A lot of my school, from nursery school through medical residency and fellowship here at the University of Michigan. After I finished my training here at the University of Michigan, I went to the University of Minnesota. And at that time, my mother had actually been diagnosed with breast cancer. And so here I was, a health professional. I had done my training here at the University of Michigan, so I knew sort of a lot about care. All of a sudden, you're in a very different role as a family member of somebody with a serious health condition, and you experience the health system in a very different way. And in that experience, I thought, gosh, there must be ways that we could do this better. And that was a real motive for me to come back and do this work in the area of health communication, to try to create that experience for all patients and all families that I could have with the advantages of having a physician in the family. So what I do every day, it's really a little bit like a kid in a candy store. Our work is around health communications, which is sort of like a core service or a common thing that a lot of people need. And so because of that, I get to have lots of meetings with lots of really smart people who are trying to improve every day the care of patients and families.
We talked about that. We talked about navigation intervention. We talked about interventions that would be maybe for patients with recurrence or metastatic disease.
And what I get to do is I get to think about the toolbox of tools and resources that we have in our center and ways that we can use those to help, whether it's a family member with a certain health condition, whether it's a physician who's trying to do a better job caring for patients or supporting families. I really get to meet with all of these people who are trying to do good things and figure out a way that we can help that happen. Our work is really built around the notion of personalized and tailored health communication. It's really the notion that there's way too much information out there for people to find and learn and use in a meaningful way. If we take some time to learn about the individual, we can put together a personalized information prescription for them that's going to be more meaningful, more valuable for them, and it's going to be more useful to them in helping with their care. Our motto really is the right message for the right person at the right time, delivered in the right way. I mentioned earlier how important it was for our family to have medical expertise and experience in the family when trying to negotiate a pretty complicated system. Only very few patients and family have those resources naturally, and what we want to do through our work is bring that resource to everybody.